Has your hair transplant result failed in 1 year? Have you seen someone near you getting a transplant done, or some celebrity who had excellent result at 1 year, and now at 1.5 years when you see him, the hair are gone? Maybe in 15 months, all these hair are gone and the result looks really empty, ugly. So do you wonder what has happened? Just 3-4 months and all the results are gone. What went wrong? Yes, if you want to know this, watch this video till end. And I am your friend Dr. Shaill Gupta. If you haven't already subscribed the channel, subscribe it and don't forget to press the bell icon to receive all the notifications. Now, hair transplant is a very common popular treatment these days and a lot of people get it done, and we see results which are good at 12 months. I see these patients on some social media platforms where they were giving interviews and testimonials for different clinics globally, in India, Turkey, different part of Europe or US, and then 15 months, like just 3-4 months after that testimonial, they are sitting in front of me for a repair hair transplant. So what went wrong? After seeing thousands of such patients, I'm giving you this conclusion. This is very important and please watch the video till end. So the number one pointer here is over treatment. Many of these patients are put on 1 mg finasteride irrespective of their age, their grade of baldness, progression of disease, availability of donor, or previous treatment history. They are put on the medication 1 mg finasteride, and this medicine can do wonders. Sometimes it contributes to the results to an extent that almost 80-90% result is coming through the medication. And we have already shown you so many patients where this has happened. You can see the links of the medicine are given in description. The playlist is given. Go through these videos. These videos are very important if you are planning your journey. Now, these patients are at peak of results. They are shown, the testimonials are taken, and when the patient stops medicine or the medicine stops working on patient's head, 3 months, 4 months, 5 months, everything is gone. And then these patients are not shown to you. Number two reason, no treatment. See, if not everyone needs the medicine, not everyone will not be needing the medicine also. So in some patients, medicines must be given because the hair loss is aggressive thinning. So if someone says, oh, you don't need any medicine, nothing, no, it has to be customized according to the patient's need. Now see my case, I am 46, I did my transplant 2 years back. I'm not on any medication because I don't need it. If I take the medicine, it will improve all the 5 aspects of hair transplant, which improve significantly with the medicine. They will happen to me also. But it is my choice whether to bring the medicine on in my ecosystem or not. But yes, I'll take care of it that I don't push this medicine unnecessarily to everyone. Third important point here is misinformation. Many a times patients are told, and this is a very common thing which has happened, and I'm telling you after seeing thousands of repair cases, it's been told that you take the medicine for 6 months or 10 months and then we will see. No, it doesn't happen. Okay, if you take the medicine for, if you start the medicine, you cannot stop it. In most of the patients, you won't be able to stop it. And if you stop, you will have severe rebound. So when the patients are being told that, okay, you take it for a specific period of time, patients are happy. They go for the transplant. But upfront, if you tell them you can't stop it, or you tell the limitations, they may not go for the transplant at all. But it is better to know everything upfront rather than, getting surprises or shocks later on. So it is important, plan your journey and see whether it is being done for you or for the clinic. Fourth important point here is tolerance. So when these medicines are given, as we know, anything which is taken for a long period of time can induce tolerance. The body may stop responding to it. That means these medicines have their shelf life. So you have to be very careful. Start with low doses. You can upgrade the doses. So the overdosing is a problem. Underdosing is also a problem. So let's talk about the midway where we titrate the doses, and the concept is microdosing. It really helps, and I've been doing this in many of my patients. If you see these cases here, there were I mean, we did not start the medicine in the beginning, but the hair growth was really affected. Even the transplanted hair were not growing to their full potential, and the existing hair were thinning out at a rapid pace. So just inclusion of small doses of finasteride helped. In 3 to 4 months time, it showed miraculous recovery results. So nothing is going to happen even if we start these medicines after some point. It is not necessary that you start immediately at the beginning. And fifth point, another resource which is important, that's PRP. You will see a lot of people are being told that you go for PRP sessions 5, 6, 7 after transplant. No, it is not done. I mean, I am myself a transplant patient. I have done just 2 PRP sessions since my transplant in like last 2 years. So that means repetition actually puts you at risk of developing tolerance. So we have got limited resources in form of medication, in form of PRP, and in form of donor. So always remember, the formula of Satya is less is more. So don't put everything at stake. But when you are scared, when you are emotionally volatile, fragile, you put everything at stake, and that is being misused through all this. Not all the results which you see as failed after maybe 1.5 years are good transplants. They were initially also failed, but they were just covered up through medicine. Now when the dust is removed, we see the actual face of transplant, and this happens in so many cases. And unfortunately, these patients don't even know that they have been cheated, and they still keep thinking that they had undergone a beautiful transplant, and they cannot say anything to the doctor also, because it seems uh, the 6 month, 7 month, 10 month result shows wonderful recovery, so with medication. So please be careful. If you don't want to fall prey to these tactics, plan your journey. And there is a free e-brochure, link is given in description. You can go through, you can download that for free, which is 7-step guidelines to plan your hair transplant journey. There is a contact form given if you want to plan your journey with us. Fill that form. If you have really faced these issues, write down in comment section. We need to increase the awareness of this entire community who is doing transplants, who is taking these transplants, and being a member of both, as a transplant surgeon, as a transplant patient. I owe this to the society. That is why you see these important information videos coming from us, so that awareness levels are increased. So if you haven't already subscribed the channel, do subscribe it. In the description, a big playlist is given where you can know more about the medicine. You can know more how to repair these cases. What will happen if you go for another FUE transplant after FUE? Everything is given. Watch the videos, spend some time on research, and that will really pay you through good transplant results, and you'll be able to plan your journey. Wishing you a lot of luck in your journey, and have happy hair.